Scanning the room.
My name is Tiffany, and I'm going to be demonstrating the insertion and removal of an indwelling catheter, as well as irrigating the catheter and explaining a clean catch urinalysis. So I have got my doctor's orders. I am in the supply room. My patient is Lee Cost, 5/14/1964. The doctor has ordered a clean catch urinalysis. Now, insert indwelling catheter after clean catch urinalysis. Irrigate catheter with 30 mils of 0.9% normal saline as needed. So I'm going to start. I've performed hand hygiene. I'm going to start with the urinalysis. I need a sample cup. I need my 3 wipes. I need the patient's labels, which is Lee Cost 5/14/1964, Lee Cost 5/14/1964, and I've got my biohazard bag. Put these in here. Next, I need my indwelling catheter set. I am going to grab a chuck. I'm going to grab tape and just make sure that's started. And I am going to grab a 14 French Foley catheter, and the expiration date is good, so everything is great. We're going to take that with us. And I have everything I need at the moment, and we are now going to go into the patient's room. So I'm going into the patient's room. Knock, knock. I've introduced myself to my patient, and I've asked for his full name and date of birth. His name is Lee Cost, 5/14/1964. That matches his armband, Lee Cost, 5/14/1964, as well as the doctor's orders, Lee Cost, 5/14/1964. So I have explained to Lee that the doctor has ordered a clean catch urinalysis, and I'm going to make sure that his bed is all the way down to the ground and put his rail down a little bit. I'm going to explain to Lee that I'm going to give him a sample cup, and he is going to go into the restroom because Lee is able to get up and out of bed, no problem. I'm going to give him 3 wipes, explaining that he needs to clean the penis, starting at the meatus with the first wipe in a circular motion, working his way down. He's going to do the same thing with the second wipe and the same thing with the third wipe. I've also explained to him that because this is a clean catch, he needs to void into the toilet first. He has great sphincter control, so he's going to be able to stop midstream. He is then going to void into the cup. And I've explained to him not to touch the inside of the cup because it is sterile, and to make sure when he takes the top off that he lays the top down to the table. So while Lee is up and giving me a urine sample, I am going to don gloves. And he is coming out of the restroom. So I am going to date and time of 13:45 with my initials on his label. He has handed me his cup. I'm going to make sure that I label the front of this. And I'm going to place this in the biohazard bag. I am then going to seal this up. I am going to give it to the CNA so that she can take it to the laboratory immediately. And while Lee is getting back into bed comfortably, I am going to document the color and the consistency, and I'm also going to document how much that he voided into the cup. So I'm now going to take off my gloves. I am going to perform hand hygiene again. And I'm going to let Lee know that the doctor has also ordered the indwelling catheter, which we are going to do now. So I am going to move Lee up to waist level. I have placed a bath blanket over my patient, and I am pulling this down. And I have made sure that it is okay with my patient before I expose him, and he says that is okay. So I'm now going to pull back his gown, just exposing the area that I need. And I am going to get a check, and I'm going to place this underneath. This is going to catch any urine or any water, anything that might drip. At this point, I would don gloves and I would perform perineal care if needed. If he was circumcised, I would pull the skin back and I would clean, I would pat dry, and then I would make sure that the skin was placed back. So, take those off, performed hand hygiene again, and I'm now going to prepare my sterile field. I'm going to get my tape ready. And I am going to put that actually right here next to the bed. And I am going to take my Foley catheter, which is sterile, open it, and pull this out. I'm then going to turn the bag into itself a little bit so that I can turn this into the trash bag. I'm going to set that right there at the end of the bed. Again, I'm going to perform some hand hygiene. I am now going to open up my sterile kit. I'm going to start by grabbing no more than 1 inch, and I'm going to pull away, pulling down, making sure that it does not come back into itself. I'm now going to pinch the corner here and the corner here, again staying inside that inch. And I am going to pull this, same thing, making sure it does not come back into itself. And then I am going to pinch this and pull it back. And now that it is open, I will very carefully rearrange. So I'm going to start by taking out my gloves and setting these to the side. I would open up the drape. And this is going to go shiny side down. This is just a little extra added protection, just in case. And this part we would normally use to drape the patient, but for camera purposes, I am not going to do that. But the diamond shape would lay over him. And now I am going to don my sterile gloves. I am going to open the package. I am going to make sure I fold so that it does not come back up on itself and contaminate the gloves. I am then going to reach under and pull open. I am then going to start with my dominant hand. I am going to pinch, and I am going to pull. And then with my dominant hand, I'm going to grab under the cuff, and I'm going to insert my non-dominant hand. Now that they're on, I can straighten out the fingers. And we can begin. I am going to take out the tray, and I'm going to place this in between the patient, his legs. I am going to take the plastic piece off, And I am going to attach this so that it's ready to go. I am going to take this piece off. And I am going to get the swabs ready. I am going to set that right here. Okay, at this point, I'm going to take my non-dominant hand. I am going to grasp the patient's penis, and I am going to swab. Come on, seriously. We're going to start at the meatus in a circular motion, and we're going to work our way around. I am then going to get another one. And I'm going to do the same thing again. Swabbing from the meatus in a circular motion and dispose. And I'm going to get the last one. And I'm going to swab in a circular motion. We are going to dispose of this. Then I am going to get my assistant to spray the end of my catheter. Normally we would lube, but because of the mannequin. And then I'm going to tell my patient to take in a deep breath and to blow out like he's blowing in a straw. On the count of 3, 1, 2, 3. And I am going to insert as he's blowing out on a male. It is approximately 7 to 9 inches until I see a flash of urine. And once I see the flash of urine, I am going to insert another 1 to 2 inches. I am then going to push my water that will fill the balloon at the tip, keeping it inside the bladder. And normally this would go into a biohazard bag, but I'm saving this for the irrigation part. And at this point, I am now going to take the bag and I am going to tape to the patient's leg. And I want to be careful that we have no kinks. And I'm going to hang this on the side of the bed. And I'm going to clip this to the patient's gown. Pull this down. I'm now going to take this out of the way. I'm going to take off my sterile gloves. I am going to perform a hand hygiene. I'm going to take this out of the way. We do have the check there still for protection. So go into the bag. And now I am going to document how the patient tolerated well. I'm going to also document that the tip of the catheter was intact. Everything was good. Looking, there still is not much in the bag, so we'll just document what we see. So now I performed hand hygiene. I'm cleaning up the room. I will let the patient know that if he needs anything, the call light is right here. I would set him up. I'm performing hand hygiene, and then I would leave the room. And while I'm out of the room, the doctor has come by a few hours later, has given me new orders. So I am going to go into my supply room, and the order is to irrigate the catheter with 30 mils of 0.9% saline. So I want to get clean needle. I've got my clamps. I've got my 0.9% normal saline. I've got a wipe, and I've got my irrigation tray bulb syringe. So I'm going to take this, I'm going to go back into the patient's room. I have performed hand hygiene. I've introduced myself to the patient, and I've got his full name, date of birth. He has confirmed Lee Koss 5/14/1964. Lee Koss 5/14/1964, which matches my doctor's orders. So I've explained to Lee that we are now going to irrigate his catheter because there is no urine output. So there might be a blockage. I am going to don gloves. And I would let the patient know I'm going to pull the covers back a little bit and that I need to expose him. I would get his permission first. He says, okay. So I'm going to pull this back. At this time, I would make sure I inspect any skin for any kind of breakdown or anything. I could also take a wipe if I wanted to, if need be, and I could clean the first 4 inches with an alcohol swab. But everything looks good. So we are going to get out our irrigation and my saline. I am going to clamp off just below. This way when I irrigate, it doesn't go straight back into the bag, and the patient, it will circulate through the patient's bladder. And my saline and my syringe. My alcohol wipe. So I am going to clean the port for 30 seconds. I am going to get a clean needle, and I'm going to lure lock that in there. I'm going to get my 30 mils. And obviously for video purposes, we're actually not getting anything because it would ruin the mannequin. So I have pulled my 30 mils. And I am now going to flush the tube. And again, this is going to go up through, and it's going to help irrigate not only the catheter but into the patient's bladder. So if there's any kind of sediment up there that might be blocking, I'm going to take this out. This would go straight into a sharps container, but because they need this for other videos, I am going to do the scoop technique. I'm going to grab on the sides. And then I will dispose of the needle. Okay, so I'm now going to unclamp. Make sure that there's no kinks. And I see that we are getting some flow back, which is good. I'm going to cover the patient. I'm going to take off my gloves. I'm going to perform hand hygiene. And I'm gonna see if the patient needs anything. I'm gonna document that we did the irrigation with the 30 mils of water. This way, when we come back in and check the bag, we know to deduct the 30 mils from whatever's in the bag, then we know what the actual, how much urine is in there. So I place this thing up. And I let him know I'll be back to check on you in just a little bit. I'm going to do my aftercare, make sure everything is cleaned up. And then I am going to, the doctor has another order. So I've got my doctor's orders, and it is now time to discontinue the indwelling catheter. So I'm going back into the patient's room. I have performed hand hygiene. It looks like we have a good, about 400 milliliters in there. So I definitely want to make sure that I document that on the output, that there was 400 mils minus the 30 mils from earlier, if that has not already been deducted from another shift. I'm going to introduce myself to my patient. Again, full name, date of birth, full name, date of birth, full name, date of birth, and explain to Lee that we are going to finally take out this catheter, which he is very happy for. So, performed hand hygiene. I'm going to roll this back. I am going to don my gloves. Again, I'm going to make sure that it is okay with my patient that I expose him, and he says yes, he's more than happy to get this out. So we are going to pull this back. And I'm going to unclip this from his leg. And I'm going to get the needle, I'm going to get the syringe. And we are going to attach that there. And it starts drawing back. And we need to make sure we empty the balloon before we pull it out of the bladder so as not to damage any internal. So we're gonna let this go. We're gonna wait for some air bubbles. Make sure we get everything out. Lee's doing good, he's hanging in there. And I do see air bubbles coming through. Excuse me. So I am going to now tell Lee on the count of 3 to take a deep breath in. I'm going to grasp the penis again. And count of 3, take a deep breath in and blow out like a straw. 1, 2, 3. We pull this out. I'm going to detach this from his leg. And we would document what was in the bag, which I have done. So I'm going to detach that. I am going to wrap this up in the chuck. This is going to get disposed of in the biohazard bag. At this point, I would change my gloves, doing hand hygiene in between, donning new gloves. I would do any perineal care that needed to be done on the patient, making sure he's good. I will put down his gown. I'm going to pull this up. Again, I'm going to document that the patient tolerated well. The tip was still intact. I'm going to document the output of the urine. I'm going to document the color and the consistency. Place his bed rails up and let him know if he needs anything to please call with the call light. I'm going to take off my gloves. I'm doing after room care, and I'm done.